Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide.
Bill McGinley is the president at the American College of Healthcare Administrators. Let's start from the beginning. You used to be in the field yourself?
The American College of Healthcare Administrators is the professional organization for long-term care and post-acute administrators. So we're the professional society, if you will. We've been around since 1962. We're originally formed by a group of geriatricians when they saw the Medicare and Medicaid regulations coming down the pike, if you will. They knew that as part of those regulations, nursing homes were going to be licensed, they were going to be regulated, and they were going to need a better educated and better prepared administrator. So in the early days, the organization was formed largely to provide education.
You used to be in the field yourself, correct?
Yes, I started in 1980, 41 years ago. I entered as a department head in a nursing home. I had graduated from college. I had a bachelor's degree in biology. I knew that I had an interest in the field of healthcare. I had some previous supervisory, low-level management experience, if you will. I thought that I could combine my love of medicine, biology, healthcare with that management experience, which, to be honest with you, I assumed meant that I'd be working in a hospital. I had never been in a nursing home. I did not know anyone who had ever been in a nursing home. As it turned out, the first job that I got was in a nursing home in Boston, Massachusetts, and I started as a department head, and less than 2 years later, or just about 2 years later, I became a licensed nursing home administrator in 1982. That's when I joined the American College. A coworker of mine who was a member approached me when I got my nursing home administrator's license and said, "You're a nursing home administrator now? You need to be a member of the American College." Back then, we were called the American College of Nursing Home Administrators. So I joined. That was a unique company that I was working for back then in the early 1980s. It was called the Greenery Rehabilitation Group. And even though they were organized and licensed as skilled nursing facilities, we were taking care largely with young adults with traumatic head injuries, brain damage. So I stayed with them for 12 years, went to another organization, and I ran another nursing home for 6 years. And then I landed a job in the town that I live in Massachusetts, and stayed with that outfit for 18 years. I ran a large assisted living residence, 88 apartments. It had a 53-bed nursing home. We offered adult day health services, and we had an on-site child care center as well. So I spent 18 years with them.
Oh, wow. So you have a total of 40 years experience in the healthcare.
41 years this past February, yes.
That's not bad. I'm already at 6 months. I'm getting there.
All right.
So how has this experience, this 41 years experience, help you navigate through the maze of these healthcare issues?
One thing that you learn as a nursing home administrator, or at least I've learned and I believe, is that flexibility is really, really important. You don't want to get stuck in a rut. I think one of the best things about being a long-term care administrator is the variety in the position. It's a job that requires a great deal of flexibility, and that, I think, has helped prepare people to deal with this COVID situation. I mean, it's been a horrible situation, as you know. The federal government in the early days, and perhaps even to some extent today, has not been the greatest of partners through this whole thing. We've suffered from a lack of direction, conflicting and often changing regulatory environment.
So I saw you wrote an article on PPE. Can you talk to me about that?
In our best days, nursing homes kind of start off behind the 8 ball. On a good day, we're underfunded and understaffed. There's no other way to say it. Our workforce is largely working women, many of them single women, many of them single mothers, many of them working 2 jobs. It's a very, very difficult job. And then, along comes this virus, this insidious virus, invisible, able to be transmitted without displaying any symptoms. So no one even knew it was in your building. And we get caught off guard. Staff who suddenly are now very fearful. They're fearful that their jobs may cost them their lives, and sadly, in many cases, it did. It was a horrible situation, and I think the focus of that article was, at the time, it was in the early days when nursing homes were really starting to take a lot of heat and be vilified in the press for the large number of deaths that were occurring. And I just thought it was unfair because people don't really understand the nature of the work that goes on in these nursing homes. I mean, our business is a high touch, not a high tech business. I mean, robots cannot do our job. You've got people that are doing the most intimate tasks, brushing other people's teeth, bathing them, dressing them, helping to go to the bathroom and clean up after that. The fact that the virus spread so quickly should not have been a surprise to anyone. And yet nursing homes were raked over the coals in the press, and I just thought it was tremendously unfair.
Yeah, I mean, that's one of the goals of the Sniff Spotlight website, is to really try to bring a spin and hear from the insiders.
Exactly.
Would you say there is a formula to help administrators navigate a similar path to yourself and your career?
One of the things that any early career professional can do, and I don't care whether you're a nursing home administrator, a CPA or a lumberjack, my advice to young people in their field: join your professional organization. Every field has got one, because it does so many things for you. First of all, it puts you in touch with people that do not work for the same organization that you do. That does a couple of things for you. Sometimes you just need to have a conversation with someone who doesn't work for the same folks that you do. It also puts you in touch with educational opportunities and networking opportunities that can lead to career growth. And that's where the networking comes in. It can really help further your career. So in terms of a pathway, I think one of the best pathways is professional organization membership.
Even with LinkedIn, I don't feel like people are connecting with each other enough. Like, there's so many opportunities. You never know where that comes from. It's just, networking is so vital.
That's a lesson that I don't think young people grasp fully, but it's something that I try to impress on young folks. I don't mean to be trite with the old expression of it's not what you know, it's who you know, because what you know is very, very, very important. But who you know is also something that can help you in your career growth.
So tell me about the administrators' needs during COVID and how mental health has affected them.
At this point in time, we're kind of at the 1-year anniversary. It was, this week, a year ago, that this really hit home. Lockdown started to happen. The social isolation started to happen. Nursing homes were restricted. And since that time, there were nursing home administrators, and I was talking to one yesterday, that literally have not had a day off in a year. And I don't mean a day off from your 5-day-a-week job. I mean, they've been working 7 days a week. In terms of the mental health issues, on top of the stress created from trying to manage the whole situation, understand the regulations that are changing weekly, daily, in some cases hourly. You're dealing with staffing issues. Like I say, you weren't starting off in a great place, but now maybe you've got staff that are either genuinely sick and can't come to work, or are afraid to come to work because they don't want to bring the virus home to their own family. And you're watching your residents pass away. And in some cases, you're watching your staff pass away. The strain, the mental strain on the profession over the past year has been unlike any situation that I've encountered in my entire 41 years. I mean, I've seen stressful times, but nothing has affected the mental health of the profession as this pandemic has. And I worry what that means long-term for the profession. I know so many people that have said, I won't leave my team in the middle of this crisis. But they're not shy about saying when this thing is over, they may seek an alternate career. So we're going to see a mass exodus of nursing home administrators leaving their jobs this year. It's hard to say, but it's entirely possible. Hand in hand with that is, what does it mean for young people who are thinking about going into the field? I mean, over the past year, if you've done nothing but read headlines in the newspaper about how horrible nursing homes are, there weren't a lot of young kids who woke up when they were 8 or 9 years old and said, gee, I think I'll be a nursing home administrator someday. There weren't a lot of those to begin with. But now, think about having read all these headlines over the past year and thinking about a career in the field of healthcare. Are they really thinking about long-term care now? The last thing I'll say about it is, are we going to see some kind of a post-traumatic stress syndrome thing? When all this is over, if it ever gets to be over, and I know the vaccines are helping and everyone's using the expression, there's light at the end of the tunnel, but, we're still in the tunnel and it's a long tunnel. And it's going to be a long time before we go back to normal.
The light at the end of the tunnel, I always thought was a train.
Exactly. It could be a train coming right at us, and I hope it's not. My advice to administrators is when you have the opportunity, obviously, take care of yourself. Take care of your family. Do the things that you need to do to find some time for yourself and take some downtime when you're able. But just as important is when things settle down in your particular nursing home or assisted living residence, find a way to get your whole team together and kind of collectively dissect this. Come together and first of all, acknowledge everyone's hard work, acknowledge all the people that passed away in your home, whether it's residents and staff, because remember, people are dying. You don't even have time to acknowledge that. There aren't even any funerals to go to. So people haven't had a chance to grieve. There's a lot of grieving.
We're in this together. How does your association help with networking needs along with education?
In normal times, pre-COVID and hopefully post-COVID, a lot of the activity in our association takes place at the state level. We're organized into state chapters, so every state, has some type of an organized chapter of the organization. And a lot of the education, networking, and social events take place at the local level. At the national level, we have an annual convention, a conference once a year. Our organization refers to it as the convocation, which means coming together. I always tell young people and anyone in the field, if you've never been to a national gathering of your own profession, by all means find a way to do it because it's just fun. During the COVID times, what we did was we made large amounts of education available, not only to our members, but we opened it up to non-members as well, so that administrators could receive all of the education they needed online, because you need that education to renew your license. Whereas these things are normally available only free to the members, we opened it up to the world at large, and it was tremendously well received.
You're a busy guy. How does someone get in touch with you?
Easy to get in touch with me on LinkedIn. Follow the American College of Healthcare Administrators on LinkedIn. I keep my email address nice and simple, bill@achca.org. Follow us on LinkedIn or follow us on Facebook, and you'll be immediately connected to your state chapter, and you'll start getting information sent to you both from the state level and the national level.
Thank you so much, Bill, for joining us on the SNF Spotlight. It's really an honor and a privilege.
It's my pleasure.
Thank you for making the industry a much better place.
I appreciate your time. Thank you.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.